All right, testing. Hi there. My name is Colleen. Sorry. All right. Hi, Hope. Nice to meet you. My name is Colleen. I will be the attending social work for right now. You probably know me from our school's social work. There's a couple of us. I
hmm
just want to say thank you for meeting with me today. How are you doing today?
I'm okay. A little stressed, but you know.
All right. So what we're going to be doing today, I'm just going to be kind of going over a general little assessment so we can see what's going on with you and see if there's anything that we need to do or get like some goals for to help support you. Is that okay?
Sounds good.
All right. And I before we get started, I want to say I might be taking some notes at any point that you're talking. It's not that I'm not going to be listening to you. I just want to make sure that we get everything transparent and if we need to look back at it, then you'll be able to access them as well.
Okay, awesome.
And then I just want to quickly go over our confidential screening statement. Are you familiar with what confidentiality is?
Yes, I am.
Yeah, everything between us today will be confidential. The only times where our limits of confidentiality will be if I'm made aware of any sort of abuse, neglect, sexual, emotional, or physical. Um,
Okay.
I still feel hope that you can feel comfortable, but or if any of my notes get subpoenaed. Not that they will, but I just want to let you know that is where my limits of confidentiality lie, okay?
Okay.
Okay. So why are we here today?
Um, so pretty much I found out that I'm pregnant. I found out like 2 or 3 weeks ago. And I'm really just having a problem deciding whether or not to have an abortion or to keep the baby.
Okay. Okay. So, and then do you know how many weeks you are along?
I am 6 weeks.
Okay. And just trying to get over some basics. How old are you?
I'm 16.
Okay. And I would like to start a little bit more in your early childhood just to get a good profile shot of who you are. So
Okay.
how was your health at birth?
Everything was normal from what my parents have told me. It was normal birth weight, didn't have any like issues or anything like that.
And as for developmental milestones, do you feel that there was anything that stands out per se?
Um, no, I don't think so.
Okay. And I'm just looking at your chart from our school history, and it looks like you were in the program for when you were a bit younger, like after in middle school. Is that true?
Yeah, I did that in middle school. My parents were working, so
Nice. Okay. And how did you like that?
I liked it a lot. I met a lot of friends there, so it was a nice place to socialize after school.
So are you currently working or anything right now?
Besides school, I work at the supermarket in town.
Oh, nice. Just down the road.
Yeah.
How's school going? Are your grades going okay?
They're pretty good. They definitely could be better, but nothing like concerning. I'm not like failing any classes, so
What's your favorite subject right now?
I would say English. Anything but math. I hate math.
Okay. Yeah, I can relate. Know what you mean. All right. So just moving on, going into your family, what is your family structure? Like, do you have any siblings?
Yeah, I have an older sister and I have a younger brother.
What are their names?
Gina and Tommy.
Nice. Okay.
Yeah.
Does your family, your parents have any psychiatric history or diagnosis?
My mom has some history of depression. I know she was diagnosed when she was younger. Um, and my dad struggles with alcoholism.
Okay. And how does that affect you?
It's pretty tough. Uh, it's just like a draining, I guess, to come home to my dad sometimes, but for the most part, he's like high functioning, so I guess like things could be worse, you know?
And are they both employed?
Yes.
Nice. Okay. Do either of your siblings have any mental health diagnoses?
My sister has been recently diagnosed with depression.
Mhm.
And my brother doesn't have any diagnoses.
Does anybody besides your dad have any substance misuse?
Um, my brother drinks sometimes, but I wouldn't say it's like uh an issue yet, like overuse.
Okay, thank you. And then so you mentioned you have a small group of friends
Hmm.
at school. And then do you have any faith or spiritual history?
Um, my family and I are Catholic, but we don't really practice. We go to church like once a year, maybe.
Been Christmas or something?
Yeah, we go with like our extended family on Christmas Eve.
Nice. Have you received any services from those other like the doctor or any community services?
No, I just have like my primary care doctor that I go to, but that's really it.
Any legal experiences or arrests? Okay,
No.
good to know. And if you have any substance use, like do you drink alcohol?
I don't drink, but I do vape, but I actually stopped when I found out I was pregnant. So I've been like, I guess, vape free for like 3 weeks.
Oh, okay. Good. That's good for you. I know how hard it can be and
Yeah.
like, with all those flavors nowadays.
Yeah.
Okay. So when did you start with the nicotine?
I started last year, so when I was 15.
And then how frequently would you describe your use as?
I'd probably do it like 5 to 10 times a day.
Okay. Okay. Do you have any withdrawal symptoms from that use?
At first I had really bad headaches, but um that was really it. I feel like this week is like the first week where I'm starting to feel like normal without it. So
Okay, well, that's good. Do you feel a
yeah.
little bit better when you're not vaping, or do you not that incessant need to?
Yeah, I think it's nice to not like worry about it, but obviously like a lot of my friends do it, so it's kind of hard like when they do it in front of me, but
Do you feel like that they're supportive of you quitting?
um I think so, but not a lot of them know that I'm pregnant, so they don't really like understand why I stopped. So,
Right. And so you said you're about 6 weeks.
yes.
So I do know that the clinic down the road is they have like kind of a time frame for medically induced abortions with I think it's like a pill up to 10 weeks. Is that something you're interested in?
Yeah, I just haven't like fully decided if that's what I want to do yet, but I'm interested in it.
So you're still kind of figuring out the pros and cons.
Yeah.
Okay. And did we talk about allergies already?
No.
Do you have
I'm
any
just
medication allergies?
no.
Anything else that you could be allergic to?
Just like pet dander.
Okay. Sounds good. Have you been prescribed any medications in the last year or two?
No.
Or 6 months? Okay. Nope. Okay. And no psychiatric medications?
No.
Are you on any vitamins or anything?
No, I'm not. I've been debating on starting to take prenatal vitamins, but I
Yeah.
haven't decided yet. So
All right. Do you feel that you've had any panic attacks over since finding out you're pregnant?
I wouldn't say I've had panic attacks, but I've just been overall much more anxious than I was before I knew I was pregnant, but I haven't had like any actual attacks.
Okay. Any sleep changes in your patterns of sleeping or waking?
I've definitely had a much more tough time sleeping. I wake up a lot throughout the night, so that's been pretty tough.
Do you feel that you have any suicidal ideations or thoughts?
No.
Okay. Okay. Is there anything else you want to share with me today?
Um, I don't think so. I'm just overall like kind of trying to get myself the resources to make a decision.
Yeah, we can definitely get you an appointment with the clinic tomorrow. I believe I can get you down for